Let's talk about infertility workup. Background. Definition: 1 year of unprotected sex if patient is less than 35, or 6 months if they're over 30. It affects about 15% of couples. Indication for immediate evaluation: oligo or amenorrhea, known or suspected uterine tubal or peritoneal disease, stage 3 or 4 endometriosis, known or suspected male infertility. Table 1 for basic infertility evaluation. Let's take a look. So for female, history, physical, pre-pregnancy evaluation. Gotta look at another community opinion here. Additional evaluation for etiology of infertility. If it's suspecting diminished ovarian reserve, we can check these. Ovarian dysfunction, tubal factor, and uterine factor. So let's go through them real quick. So female factor, we do a history, physical exam, we check vitals, thyroid nodules, breast exam, look at Tanner staging, and pelvic exam. If suspecting diminished ovarian reserve, we can check at AMH. If less than 1 nanogram per milliliter, that's indicative of diminished ovarian reserve. Antral follicle counts less than 5. However, both AMH and antral follicle count are a poor predictor of future live births. FSH greater than 10 international units per liter, checked between cycle day 2 to 5. There is a, and then we check for basal estradiol level. If it's between 60 to 80 picogram per milliliter, this should be normal. Elevated estradiol can suppress FSH, which is also indicative of decreased ovarian reserve. History of poor response to IVF stimulation, such as less than 4 eggs at retrieval. Less than 40-year-old with elevated FSH should have Fragile X carrier screening. Ovulatory dysfunction, luteal progesterone, mid-luteal phase progesterone, less than 3 nanograms per milliliter. You can check that, or 7 days prior to period. 1/3 of women with normal menses are anovulatory. PCOS, most common ovulatory infertility. We should rule out other causes. Tubal factors, HSG has low positive predictive value, only 40%. If patient has non-patency, may require further evaluation to confirm tubal occlusion. Maybe use chromotubation. Uterine factor, myomectomy not advised to improve pregnancy if patient is asymptomatic with non-cavity distorting myomas. 20% of infertility women and 40% with abnormal uterine bleeding have an abnormal sonohystogram. 3D ultrasound improves detection of Müllerian anomalies comparable to MRIs. Male factor, 50% of infertility is caused by males. Semen analysis, 2 to 5 days of abstinence. Home collection needs to be transported within 1 hour. Unexpected infertility, unexplained infertility affects about 30% of infertile couples.